All right, everybody, this is Dr. C. We are at the Austin Gynecomastia Center, and we have what we call a simple procedure today, which is a nipple reduction, which is a not uncommon request that comes with gynecomastia. So part of the problem with gynecomastia is that, we have mounds that make us look like we have breasts, but sometimes we actually have mounds and nipples, and sometimes we just have nipples. If our nipples are bigger than average, what happens is we put on shirts and then we got these kind of headlight things. And that may be okay for the girls, but it really doesn't make us men look particularly cool, right? Yeah, we'd rather not have that. So really what I'd like to show you is a simple rendition of how we treat big nipples. Now, in this case, my good friend here doesn't really want anything, so I'm with you. It's not a big deal whether you have nipples or not. We have our reelers, that's everything. But I'm going to leave him a little bit of something so he has a little mound, but not enough to make it poke through his shirt. So if my videographer, John, can look down here. Can you see these, John? So they're looking pretty prominent, right? Okay. And what we're going to do is reduce this prominence and put in a simple stitch. So, like I said, in John's, John's the videographer, but in his case, he doesn't really want much. So I'm going to get in here and remove a fair amount, okay? So I'm going to show you how easy that is. That's all this, so that's the top part. And it's easy enough, okay? So all I do is take a little piece of that off, and then I come over here and I grab a little bit of stitcherooski. And
taking that off?
I sure did, my friend.
Wow.
So he's already asked me if I already took it off. So, and I'm going to put a little stitcherooski in here just to make this heal up easy. If I didn't use anything and we were in the middle of some place where we didn't have any surgical stuff, we would just trim that off and with a tree branch or something, and then it'll heal up by itself, okay? Mm-hmm. And I put in this little simple stitch here, and this stitch will go away by itself, okay. All right? So then this is all done, and boom. So you can see that's flatter. It's a little puffy now just because he has some local anesthesia in here, but that'll heal over and that'll shrink down, all right? And so that's what he had, okay, this part here, and now it's gone, okay, so that's pretty cool. All right, so let's switch over to the other one. And then again, you can see the difference, right? So look at that. So that's a big prominent nipple.
Hold on, before you do that, can you lift it off? Let's see, one done, one not done.
Oh, sure.
Thank you.
Okay, so again, John's just showing you one's done and one is not done, just to get the idea. And then we're gonna come over here and take this off here. Boom. All right. I think this one's a little bit bigger, so I'm going to take a little bit more tissue out of this one because I think it's just a wee bit bigger. Boom. And boom. Okay, that's better. I like that. And then I come back with my stitcherooski here and just close that up. So, and my good friend here can go back to golfing tomorrow if he wants to. But he'll have a little Band-Aid on this, obviously. Yeah. It'll take a day or so to kind of dry up, but not a big deal.
So is that just kind of like a wart?
Yeah, it's just a bump, These bumps that we don't mind on girls. Even on girls, they can get too big, but moral of the story is it's easy enough to take care of. So, as they say, I don't want to make a mountain out of a molehill. Right. That's the last thing we need to do. So let's just take care of it. You think about it. What I love about procedures like this is that it's easy as pie. Okay, I don't make it more difficult so that people think I'm all special and everything. In fact, I'm just trying to show you this is nothing. And it makes these people so happy. I mean, come on. I mean, isn't that beautiful? If you can do something simple and keep people happy, I think life is good.
Oh, I love it.
So I'll put in one last stitch here, and then we'll be done. And then John will just pan off and we'll show you both sides that they're done. And then my good nurse Mara is going to put on a Band-Aid. Wow. Okay, so that's done. Get this off, and I'll show you this other one was a little bit bigger, but and this was like that, okay? So it's a nice difference. And again, there's a little prominence here, but believe me, this is going to shrink. When you've done this 150 times, you realize you got to leave a little bit so it just goes back to normal. All right, but you get the idea. Now he's got normalcy. You won't have to worry about putting a polo shirt on or a t-shirt or anything like that and have this nipple stuff going. So that's nipple reduction. Easy as pie, ABC. Thank you, and we hope that you enjoyed this. If any information is necessary, go to the website, AustinGynecomastiaCenter.com. Thank you.